more higher who have an abnormal sleep pattern or night shift patterns, etc., because of the hormones that are not released correctly in these group of people.
Doctor, since we are talking about this circadian rhythm, right? So I also want to know how the body internal clock plays a significant role in our health. Since you just talk about that sleeping and day is different, and having the different blood sugar in daytime and nighttime. So I want to know how do these rhythm influence body blood pressure and body sugar fluctuation through the day and night.
Yeah, so as I told you, there are certain hormones released in the night and we need a good night's sleep. So we have noticed that the glucose metabolism is affected if these hormones are not secreted with the normal circadian rhythm. So this predisposes you to pre-diabetic, or you could become a frank diabetic. Also, the night sleep is associated with the hunger hormone. So if your sleep is disturbed, the hunger hormone becomes more. It makes you eat more of junk food or consume food binge eating, and that makes you more obese along with the metabolic syndrome predisposition. So these are all part of the metabolic syndrome. So sleep is an important part of your metabolic syndrome. So disturbed sleep, poor sleep architecture, your increased risk of metabolic syndrome, which is obesity, diabetes, hypertension, and cardiovascular risk factors.
Doctor, this is something which I personally want you to, guide our users. What I've seen, people come to us, and especially those who are, below 35, that they are doing binge eating at night, and, they say, okay, we cover our sleep during daytime, right? Even after they've given them significant, examples why sleeping on time is important. Can you guide people who just up in the night just for Netflix or, things like that? So how they are, ruining their health? If you can please help us in that as well.
As I told you, we need 6 to 7 hours of sleep. So some people tend to think that, okay, I sleep a few hours and I'll catch up my sleep on the weekend, etc. So this does not really happen. It does not help us because, as I told you, we need to go into all the stages of sleep, 3 stages of non-rapid eye movement sleep followed by the REM sleep. If my sleep duration is cut short, I lose on the REM sleep or the memory sleep as we call, because that is when my memory gets built up. So a shorter duration of sleep, I miss out all the important parts of my sleep cycle. Now, when I'm chronically sleep deprived, it adds to my sleep deprivation, and catching over on the sleep only on the weekends is not going to help. So that is not the ideal way, because normally in over 6 hours, when I go to the first 3 stages of sleep, that's the deep sleep when my body feels refreshed, rejuvenated. When I go into my deep sleep, that is when the neuronal connections are built in the brain. And that is when my memory gets built up about whatever I've learned during the daytime. If my dream sleep is going to be affected, because most of the dream sleep happens in the later part of the night or early morning. So when my duration of sleep is cut short, I lose out on this dream sleep and the early morning sleep, so my memory gets impaired. So these people are more prone for memory disturbances and probably early onset of dementia as we grow older. So every stage of sleep is important. Cutting down on the duration of sleep and trying to catch over the sleep over the weekend will not help, because you lose that part of the dream sleep or the memory sleep as we call, where your neuronal connections are built up. So neurological diseases are more common in this group of people. And also, as I explained to you, hormones are released during different stages of sleep. So that makes you more prone for obesity and the hunger hormones, which makes you consume a lot of binge eating or junk food. So that predisposes to obesity and impaired metabolism.
Correctly said, people who are sleep deprived or having night shift, they are, more prone for obesity and, diabetes. How does sleep, interact or affect blood sugar regulation? Are these specific, some plans or something which we can do to be aware of?
Can you repeat your question? There was a lot of disturbance.
Okay, I'm really sorry. I hope it's clear, like I'm audible now.
Yeah.
So as you said that, having irregular sleep or, taking naps during daytime, thinking that, we have seen in, my experience that people are more having obesity or other lifestyle disorders like diabetes. So how does sleep interact or to affect blood sugar regulation? Are there specific, plans or few things which we should be aware of to cure all these things?
Okay, so as I told you, of adequate sleep, 6 to 7 hours. Second is that sleep deprivation, it builds up, as I explained to you. Now, how do we help out? So if you have a sleep-wake cycle, as I said, even, having a sleep hygiene, we call it as sleep hygiene. It's very important to have an adequate sleep hygiene, that you go into the bed at the same time every night. Or if you're in a night shift worker, the week that you're sleeping, Draw the curtains, make the room dark. Do not look into your mobiles. Do not let your blue light affect your eye, because that's going to affect your sleep patterns. Have the same sleep timings. Avoid heavy food towards the late part of the night before you go to sleep, and maintain a diary. That's called sleep hygiene. And avoid electronic gadgets, etc., in your bedtime, which is going to affect your sleep patterns. So, and having a glass of milk which contains tryptophan really helps in having a good quality sleep. So it's not only the duration of sleep, it's a good quality sleep which is also important. And if we do not have a good quality sleep, obviously it leads us to, as I explained to you, diabetes, obesity, no dip in the blood pressure, so you become hypertensive. And a combination of all this is definitely going to give rise to cardiovascular side effects in the form of heart attack, strokes, etc. And it also leads to driving accidents because your daytime sleepiness gets increased. So you're going to have impaired memory in the daytime and also impaired consciousness. So more prone for driving accidents, impaired work-related activity in the daytime. So I would say follow a sleep hygiene in the nighttime.
So and with the same thing, I also want to know, this is something which I have, been asked for people who are above 50 and, simply they are living alone. They up in the middle of the night, and after that, it is very difficult for them to sleep. Even if they're not taking a short nap or a power nap during daytime, still they say, Vedika, it took us 1.5 hours or 2 hours to get back to sleep again. Any, things which we can do or we are doing wrong, and we can got the same thing, they can get their, undisturbed sleep for 5 to 6 hours in that case.
Yeah, so the sleep pattern actually changes as you see a baby sleeping most of the day and night. So our sleep cycle goes a lot of change right from our infancy to our childhood, preteens to adolescence to about after 50 years. So we notice that after 50 or 60 years, the sleep duration comes down. So you don't actually get sleep for 6 to 7 hours, and you tend to have a retired life. You tend to nap in the afternoon, and that also affects your sleep pattern. So usually people who are elderly above 55 to 60 years tend to have a shorter duration of sleep. They tend to have a more milder level of sleep, that is, they do not go into deeper and sleep stages. Also, they tend to have some medical problems, like maybe if they have diabetic or they have prostate problems, and they tend to go to the restroom multiple times because of nocturia. So this all affects their sleep and anxiety definitely. There are some people who also have insomnia, which tends to come up, either a short-term insomnia or a long-term insomnia, and that also affects their sleep cycle. So as you grow older, it is definitely known that your sleep duration comes down and the efficacy of the sleep also comes down. So it is much better to maintain again a sleep hygiene and restrict your sleep daytime nap to maybe 15 minutes or half an hour, as we call power nap. Because if you tend to sleep much more than that in the daytime, it is going to affect your nighttime sleep. And the more you are sleep deprived in the night, it is going to affect your daytime performance. So a short power nap of 15 minutes to half an hour is okay in the afternoon. But nighttime, definitely the amount and duration of sleep comes down as you grow older. And also the medical problems which are associated with old age tends to affect your sleep quality and the sleep efficiency in the nighttime.
This will gonna help me a lot in my, consultations now to explain them, right? So as we are discussed about insomnia, this can impact our health. Also, what are the treatments or options available to disorders like apnea or insomnia? Do we have something for these disorders?
So you're talking about obstructive sleep apnea? That's a condition.
Yes. And then insomnia as well, like people don't sleep. If they're not taking a nap during daytime, still they're unable to sleep at night. So do we have some treatment?
Yeah.
The same?
There are two types of sleep disorders that we commonly see in our practice. One is obstructive sleep apnea, which is more common in people who are elderly and those who are obese, or those who have a thyroid problem or who have metabolic syndrome, where they are constantly snoring in the night, they're choking in the night. They have obstructed sleep in the night, in the obstructed airways in the night. So they snore, they choke, their oxygen level drops down, their BP goes high, they wake up multiple times in the night without being aware actually they're getting up in the night. So their sleep pattern is disturbed. So daytime, they feel very sleepy, they feel tired, they feel unrefreshed, the BP is high, and the daytime performance is affected. So when you have obstructive sleep apnea, which we diagnose with the basis of a polysomnography or a sleep study, which can be done either at home or in the hospital, we diagnose your sleep apnea and then we recommend your therapy as per your condition. So if you have a mild sleep apnea and you're overweight or obese, we advise you to have sleep weight reduction, exercise. But if you are moderate to severe sleep apnea, then we recommend a machine called CPAP, that's called continuous positive airway pressure, which is basically acts like a pneumatic splint, which drives in air and keeps your airways open. So this is the treatment, and it is found that when you use a CPAP in the night, your sleep is definitely better. Daytime performance is better. You do not feel sleepy in the daytime. If you do not treat this condition, you're so sleepy in the daytime, you tend to not exercise, you tend to eat and sleep and then to put on more weight. So the CPAP is definitely known to improve your glucose metabolism. It helps to reduce the insulin resistance. It helps you to lose weight. At least not if not losing weight, at least it prevents further weight gain. And it definitely improves your memory and gets your BP better under control. So there are some people who are on 2 or 3 medicines for blood pressure. So when we put them on a CPAP, it is found that the number of BP medications actually comes down. Now, regarding the next type of sleep study that we have, the sleep pattern that we have is called insomnia. So there are some people who have something called as short-term insomnia, and there are some people who have chronic insomnia. Short-term insomnia is usually related to a traumatic event that they may have in the daytime. And the long-term insomnia is some people which runs in the families. It runs genetically that they have chronic insomnia. And in this group of people, what happens is that we need to see a neurologist and put them on certain medicines, which may not be addictive, a milder form of sleep medicine, which helps them to sleep better in the night. Because if you have chronic insomnia, that is also known to increase your blood pressure, increase your diabetes, etc. And obviously, your stress hormones tend to go up. So treatment of a chronic insomnia is better treated by a neurologist and who helps in the management of this condition.
Great. Okay. So this is something, this is the most common thing, as I can see in the chat section as well. A lot of people is asking on the same part. So I'm sure this is going to help us a lot in the same. Apart from this, are there any specific genetic factors or biomarkers that link sleep disturbance to an increased risk of hypertension?
Yeah. So
or maybe, yes.
Yeah. So one is about obstructive sleep apnea. It is more seen in people who are obese. So sometimes obesity runs in the family. So it's so that obstructive sleep apnea may also run in the family if there's a family history of obesity. That is one. Second, as I mentioned, chronic insomnia also tends to run in the families. Now there are some serum hormones which can be measured, like serum leptin, and obviously insulin resistance or insulin resistance levels that we say, which tells you the risk for metabolic syndrome. So we see that people who have obstructive sleep apnea or metabolic syndrome, definitely these levels of these hormones are definitely much higher than the normal population.
Doctor, we have one common question. How about snoring at night? What could be the possible reason for the same and how? Because this is something which I can see a lot of people are asking.
Okay, so snoring is in the same spectrum as obstructive sleep apnea. So normally we'll see snoring right from children to the older people. As you see in children, most commonly the snoring is because of in a cold, when your nose is blocked, nasal congestion happens. Or in some children, when they have a chronic nasal congestion, the tonsils and adenoids get enlarged. So that's a common cause of snoring in childhood. Now, as we grow older, very often I see snoring if you have a deviated nasal septum or if you have a chronic nasal allergy. Then that's the second most common cause of snoring, which is temporary. You treat the nasal congestion and the snoring could come down. Another common reason is thyroid problems. I see when you're hypothyroid, you tend to put on weight around your neck. Your muscles are more floppy in the neck, and then you tend to have snoring. Now, why I mentioned about all these conditions are these are treatable conditions. The other reasons for snoring is if you're obese, you tend to have a bigger neck circumference than the normal person, and that causes your upper airway muscles to collapse, and that's a common cause for snoring. Few people may have facial deformities, a smaller jawbone. We call it as retrognathia or micrognathia, and that can also be a familial cause of snoring. So every person who's snoring needs to be evaluated by a sleep physician as to whether it is a treatable cause for snoring. In case it's not a treatable cause like thyroid or a cold or a nasal congestion, then we do a sleep study and do the severity of your sleep apnea. Are you just only a snorer or do you choke during your sleep? Because if you're only snoring, then there is something called as pneumatics. There are some oral appliances that we can give, which will help you, or you may undergo some surgical procedures like if you have a deviated nasal septum. But if it is snoring with choking and severe sleep apnea, then you require a CPAP. So each person who's snoring, we need to evaluate whether it's a treatable cause like a medical treatment or a surgical treatment, or if it's associated with choking and sleep apnea. So if it is with choking and sleep apnea, then they would require a CPAP. So there should be tailor-made therapy for each and every patient. One size does not fit all.
Doctor, one more thing which is very common is melatonin. Everyone, any other person is, okay, I'm not feeling sleepy, just taking a melatonin, which is easily available these days on any, for Amazon or Instagram page. Can you spot some light? the effect of the same, and is it good? Or if you can guide us on the same part, please.
As I told you, each and every person, the reason for snoring is, different. So what is advertised on the social media may not actually really work for each person. You need to be evaluated by a proper sleep physician or an ENT. In some people, it may actually be multifactorial. What I mean is not a single cause alone. It could be multiple reasons. Some people have a nasal obstruction. Some people also have an obstruction in the oral airway. So, the throat and etc. So for each person, we need to have an evaluation as to what is the cause for snoring. Is it treatable in the form of medical treatment, or do they require a surgical evaluation, or whether they require a CPAP therapy? So one person, the same treatment cannot be advocated for all. We need to evaluate each and every patient and find out what is the probable cause for your sleeping patterns or your snoring, and whether you're choking. That's the most important. So without a sleep study, we would not know the severity of your snoring, because snoring also can affect your sleeping patterns. You may feel definitely sleepy in the daytime, and snoring itself is known to cause high blood pressure. So snoring should not be ignored. Also, most important thing that I would like to say, that using sedatives or alcohol is absolutely a no-no for people who have snoring, because it is known to increase the level and the depth of your snoring and choking.
Doctor, I have few clients, those, maybe working 10 to 12 hours in a day, and they say, Vedika, because of the stress levels, we are unable to sleep. In that case, also, they tend to have this melatonin strips, which are available in the markets, right? So is it advisable to have the same without doctor prescription, or how to guide them about the same, because they don't listen? That Can you help us on the same, please?
Yeah. So as you know, the stress anxiety will definitely affect your sleep pattern. It could lead into a temporary insomnia, where people undergo stress. We call it as post-traumatic stress disorders, death in the family, divorce, etc. So that people could be under, or job loss, etc. So during that time, it is known that you may undergo stress, and then your sleep is going to be affected. So even for this, I would still advise you to see a sleep specialist, because we would put you on short-term medications to help you to get, and obviously, psychological counseling helps. So medicating, more than medicating, a psychological counseling along with a small amount of medicines to help you to overcome the stress or anxiety, so that your sleep cycle comes back to your original cycle. So this may go on for 1 or 3 months, but taking treatment on our own and then probably getting addicted to the medicines would not be a good choice. So a psychological counseling with a neurological counseling with a small amount of medicines for you to overcome the stressful situation, which may be a short time, would be a much better option rather than self-medicating.
So I think this is clear now. Don't go by the social media ads or something, please. And don't go for Google. Please seek for a doctor advice, and only then, go for it. So many individuals experience nightmare awakeness. So this is also, I can see a lot of question in the chat section. How do, awakenings impact, these blood pressure tripping pattern, and should they be cause for concern as well?
Regarding the blood pressure, I explained to you that normally we take the blood pressure daytime pressure measurement in the clinic. But as I explained to you, there's something called reverse dipping, where these people actually have a normal blood pressure in the daytime, but they tend to have high blood pressure, and this tends to be missed out in our clinics. And these are the people who may come with sudden heart attacks, strokes, etc. So an ambulatory BP monitoring, especially if we find that you have stress, anxiety, and ambulatory BP monitoring is much recommended to know your BP pattern throughout the day and through the night time, so that we can guide you. Now, so as I explained to you, most of the time a BP drops by 10 to 20% in the night. So that is expected. So the daytime, if the drop does not happen also, is not good, because if a BP tends to be continuously high and not dipping in the night, that also is a cause of concern. So these people need to be evaluated and treated for it. And sleep is one of the most important causes for it. So inadequate sleep, not a good quality sleep, if the sleep efficiency is poor, are all the reasons for not dipping in the night or reverse dipping. So the importance of sleep cannot be mentioned more than this, that you need to have a good sleep to prevent this reverse dipping or no drop in the BP in the night.
So this is one more thing.
Insightful, ma'am. But I have one question. Nowadays, ma'am, people, they don't have a sleeping pattern. Most of the youngsters have been noticed, and even the adults, that they sleep very late at night. What suggestion and advice you have for these youngsters and the adults to understand the importance of sleep and how important it is to follow the circadian rhythm?
As I told you, we need to maintain a sleep hygiene and a diary. and we need to hit the bed at the same time every night. So if I give you an example, if I go to sleep at around 9:30 or 10:30 in the night and I get 6 to 7 hours of sleep, it would be awakening at around 5:30. Now, if you're going to sleep late in the night by around 12:31, and by the time you get your dream sleep or your REM sleep, it is much earlier in the morning, maybe post 6 o'clock. And what happens during that time with the sunlight coming out and with general buzzing activity, your sleep quality is definitely going to be affected. So, going to sleep late in the night is going to shorten your duration of sleep. And you may not be getting adequate dream sleep or REM sleep early in the morning because everybody is up and awake by around 6 o'clock. So it's not the normal general pattern that everybody would be sleeping. So sleeping late in the night, you are going to have a shorter duration of sleep. So you're not going to go into your deep sleep or into your dream sleep. And having a late night sleep is not really advisable. So it's like you need to have all the stages of sleep. So 6 to 7 hours, if you would count from 10:30 in the night, it would go up to about 5:30 in the morning. But if I go to sleep late, I would be cutting down on my dream sleep, which happens early in the morning.
Also, Neha, I think one more thing which we have, a lot of people sleep with their eye open, right? They don't close their eye properly. And this I've seen, with in my family as well. And we have a question on the same. Why does, people, how, what is the, that one reason that people sleep with half eye open? Why does they do that? And what problem can it cause? And how can we cure the same?
Okay, no, so that what happens is, as I told you about the non-rapid eye movement sleep and the rapid eye movement sleep. Now, usually the eyes are closed during the non-rapid eye movement sleep, but during rapid eye movement sleep, your brain is subconsciously awake. You tend to act on your dreams. So sometimes you may see eyeball movements during the REM sleep or the dream sleep, which happens late in the night or early in the morning. So you may see people, we may have them, enacting their dreams in the night, talking in their sleep, movements of the hands and legs, including the movement of the eyeball in the night and the eyes being awake in the night. So this happens during the dream sleep, and that may happen for a short period of time. The initial part of the night, it may be around 15 minutes, but subsequently, as the sleep goes on to the late night or early morning, the duration of REM sleep goes up to half an hour to 1 hour. Very often, we may get up in the dream sleep in the early morning and we may remember the dreams. So during that time, we may have physical activities going on in our body without be actually being aware about it. So if a bystander notices that we are moving our eyes, etc., or moving our body, we are normally in that type of the sleep, which is called the REM sleep or the dream sleep. Now, there may be some people who may have weakness of their eyelids and that may be open in the night when they are sleeping. This is going to cause problems because they may have dryness of their eyes and that's more likely to have keratitis, infection of their cornea or their conjunctiva. So that requires treatment and we need to investigate what is the reason for the weakness of their eyelids. So they have drooping eyelids or weakness of their eyelids. So there may be some neuromuscular disorders that they may be having. But usually when we see movement of the body or movement of the eyeballs or the eyes, these people are in their dream sleep or the REM sleep.
Is it the same reason that few people sleep with their half mouth open? Is there any relation between,
No,
these
mouth
two?
open is a different reason. So very often people sleep with their mouth open if they have a nasal blockage. So normally we shouldn't be sleeping with a mouth open because if a mouth is open, it's not the normal pattern of breathing. The normal pattern of breathing needs to be from the nose. So very often we see that a mouth would be open if there's air anchor or if there's a nasal blockage.
Thank you so much, doctor. This is really helpful. I personally learned a lot today, and I'm sure I'm gonna, pass on the same knowledge to my clients, right? And thank you so much for your valuable time, right? This is really helpful. I'm looking forward. I personally, gonna advise to my parent because I've seen a lot of issues, which we have discussed today, and I'm sure our, other those who have joined us, they have, learned a lot of things. So
I
thank you
come
so much for taking your time.
Vedika, and thank you so much, Dr. Padma, for joining us today. It means a lot because I know how busy you are and you have made time for us today and throw so much of light and information with our users, especially who have been suffering with both the problems, even the high blood pressure as well as the blood sugar readings, and how these three are interrelated with each other was very insightful. Thanks a lot once again, ma'am, for joining us today and hope to see you again and again in our platform. And whenever you come, you share some more insights and we feel ourselves so blessed to have you here.
Thank you so much.
Thank you, ma'am. Thank you, Vedika, for
Thank
this
you so
session.
much,
Thank
doctor.
you everyone
Thank
for
you, Neha.
joining us.
Thank you.